Last week, I took a much needed vacation to Punta Cana, Dominican Republic, the first time I've left the United States since returning for graduate school in 2016. And let me tell you, I had the best time, soaking up the warm weather, indulging in some muy delicioso food, relaxing by the pool, and enjoying some strong adult beverages. But even with all that relaxation, I spent time reading books that have been sitting on my shelf for far too long. And one of those books was Reclaiming Body Trust, A Path to Healing and Liberation. And I'll be honest, I started this book when it first came out, but I wasn't ready for it. I told myself I didn't have the time, but in reality, I wasn't at a place in my body journey to fully embrace what I was reading. I thought I had broken up with diet culture, but I was still keeping it on the back burner. And as Tiffany Pollard, aka New York, famously said, she's not a back burner chick, and not the word she used, but we won't keep it PG-13. And you know what? Diet culture doesn't like to be on the back burner either. Diet culture has main character energy, and it will fight to be front and center if we don't actively challenge it. Hi, my name is Tanisha Campbell, and I equip healthcare providers with actionable strategies to challenge bias, reduce healthcare disparities, and deliver equitable care. As I was reading Reclaiming Body Trust, I kept thinking about the myths that prevent healthcare providers from adopting a weight-inclusive perspective. One of the biggest problems is that health is often treated as a moral obligation. So if people aren't performing health in a way society deems as acceptable, they're labeled as bad. But if they are performing health in a way that society seems as acceptable, they're labeled good. And when I first became a health coach, I bought into this completely. I believed that eating healthy, exercising, and maintaining a healthy weight meant that somebody was taking care of their health. But what I didn't consider was how access to nutritious food, safe places to exercise, and systemic health disparities affect people's ability to meet those so-called standards. And that's why today I want to break down some of the most damaging myths I hear from healthcare providers about weight and how these misconceptions are keeping them from delivering truly equitable care. Myth number one, I don't have time to learn about weight-inclusive care. I hear this one all the time. I'm already stretched thin, I don't have time to learn this, and I get it. Time is tight, but here's the hard truth. Weight-inclusive care isn't just about another CEU requirement. It's something we should have been taught, to be honest, in school, but weren't. And the consequences of not learning this, they're serious. Weight stigma is a significant factor in health disparities, defined as preventable differences in health outcomes between populations. And in my upcoming masterclass, I'm going to share a shocking case where a patient went undiagnosed for over a year simply because their provider misdiagnosed them because of their weight. This isn't just about education, it's about patient safety. Myth number two, weight-inclusive care isn't a priority right now. With everything happening in the world, from global crises to economic struggles, it's easy to push weight-inclusive care down the priority list. But here's the thing. That's a mistake. Weight bias in healthcare directly impacts patient outcomes. And when providers assume weight is the most important factor of health, it leads to misdiagnosis, delayed treatments, and eroded trust. And let me be real. Many patients expect to be judged by their weight when they walk into a healthcare setting. So if you want to be different, we need to prove that through our actions, and that starts with unlearning the myths that we have been taught and committing to truly patient-centered care. And myth number three, weight loss is always necessary for health. This is probably the biggest myth of all, but for decades, diet culture has convinced us that weight loss is the key to health, all while ignoring the real factors driving health disparities. And let's talk about design. Grocery stores, food deserts, safe parks, these things don't just happen. They're the result of policies and systems that determine who gets access to health promoting resources and who doesn't. That's why research consistently shows that a person's zip code is a better determinant of their health than their weight. And despite what we've been told, research backs up that health at every size interventions are far more effective at improving health outcomes than the traditional weight loss model. Diet culture profits from keeping people chasing an unattainable idea, but we have the power to reject that narrative and focus on holistic health instead. And I know unlearning these myths isn't easy. It took me years to get here myself, but as healthcare providers, we have an obligation to challenge our biases and ensure we're not unintentionally causing harm. That's exactly why I'm hosting an upcoming masterclass where I'll share practical, evidence-backed strategies you can use right away to improve the care you provide. Enrollment is opening up soon, so be sure to subscribe to the EBWH community newsletter. And if you found this video helpful, don't forget to like, subscribe, and hit the notification bell so you never miss out on any new content. So let's continue challenging biases and working toward real health equity together. Talk soon.